So good afternoon, everybody. Welcome to our webinar for Dementia Action Week 2023. Before we start, I'm just going to go over a couple of housekeeping rules. So I do recommend that everybody keeps their microphones and cameras off. And if you have any VPN turned on, such as NetMotion, just turn it off for the time being, as it saves some bandwidth. As we've got a couple of people in the webinar, we want to keep things running as smoothly as possible. We will be taking questions in this webinar, and we'll have a designated Q&A at the end. In the meantime, we ask that you use the chat function to ask any questions or add any comments. When we get to the Q&A section, you may use the raise hand feature and ask a question on camera if you'd prefer. And we will also have a Mentimeter going on throughout this webinar, which will have an anonymous Q&A if you'd prefer to ask your questions that way. Finally, we will be recording this webinar for anyone that can't join it today, and we'll be sending the recording out as part of a resource pack to everybody that signed up to this webinar, and we'll also be posting it on the Healthy Brom YouTube channel. So we've got a couple of speakers today with us, and I'd just like to get everybody to introduce themselves that's going to be speaking today. So myself, I am Jordan Francis. I'm one of the public health officers in the communities team at Public Health Birmingham, and we have three wonderful speakers today that I'll just let them introduce themselves real quick.
I'll go next. My name is Edward Roberts. I'm also working in public health at Birmingham, and I'm in the older people's team. And I'll pass over to Revinder.
Thanks, Edward. I'm Revinder Johal. I'm a commissioning manager in adult social care in Birmingham City Council. Thanks.
Hi, I'm Bhupinder Bhogal, project manager for frailty within Birmingham and Solihull ICB. Thank you.
Thank you, everyone. So moving on, we'll just quickly go over our agenda for the webinar today. So we're just going to start off with a quick overview on dementia in the UK. And we're going to talk about how that relates to the community health profile work that we're doing in the council. I'm then going to hand over to Bhupinder and Revinder to talk about the dementia strategy for 2023 to 2028. And then Edward is going to finish off talking about the work we have in public health. We will be using Menti today, so sorry, Alex, do you mind going back one? So for anybody that's not used Menti before, it's an interactive quiz software that you use quite often in these webinars, and it's a way to make them a little bit more engaging. To join, you either go to www.menti.com and enter the code 68081008, or you can use the QR code there. And can I kindly ask as well that someone from the team pops the Menti link and code into the chat as well, please? And we'll just give everyone a couple of seconds to join onto that, but the Menti joining code should be at the top of all of the question slides. So if you don't get a chance to join just yet, there will be chances in a minute or two. Moving on. So to start off with, we're going to do a little bit of an overview of dementia, just as a bit of an introduction to the topic for those that don't have as much professional knowledge, as there's a big mix of professions and people attending this webinar today. So first and foremost, I just wanted to cover what dementia is in itself and kind of just give a bit of an overview. So dementia in itself is not a disease, and it's actually an umbrella term for symptoms. The ones that people most commonly associate with dementia are memory loss, confusion, and changes in behaviour, but this doesn't encompass all of the symptoms of someone that is experiencing dementia may experience, and they may experience something like difficulty communicating, problems judging speeds and distances. They may have issues with balance and movement, delusions and hallucinations. So there's a big variety of how dementia can affect an individual. And it's caused by different diseases of the brain. The one that we most commonly know is Alzheimer's disease, but there are other ones, including vascular dementia and several others. So moving on, I wanted to quickly understand what the current knowledge of dementia in the room was. So we've got a couple of questions about how dementia in the UK statistics. So the first one is, how many people do we think in the UK are currently living with dementia? So this should be on our Menti. Again, the code is at the top, and can someone please put it in the chat as well if it's not been done so already, so people can join that way. And we should see all of the live little men in the corner so you can see how many people have answered the question. See roughly what the audience's opinions are. I think we've got 42 people in the room, so I'll wait for a couple more. Thank you, Shazia. So a bit of a mixed bag there. I think people have mostly gone for the higher options, but the answer is, if you click on Alex, it should tell us, is 850,000. So it affects a large amount of people in the UK. So I think people were just going with one of the higher numbers. And moving on, please. And we also want to know, how many deaths do we think are caused by Alzheimer's disease and other dementias in the UK as a percentage? Can you press H, please, Alex? I didn't realise the results were hidden. Here we go. At the minute, we've got 6% and 9% leading. And get one more, make it up to 20. That'll be it. Okay, move on, please, Alex. So the correct answer was actually 12%. So I think a lot of people thought it was slightly lower than it is. And what we actually can understand, if we move on to the next slide, is the Alzheimer's disease and other dementias account for 12% of all deaths in the UK, and this makes it the leading cause of death. However, what's quite contrasting to that is research from Alzheimer's Research UK shows that only about 2/3 of the population even recognise that dementia can be a cause of death. And that really shows the importance of increasing our public knowledge of dementia and dementia awareness. Moving on, also would like to understand a little bit about what we can do to reduce the risk of dementia. We have a couple of options again on our Menti. So it's these lifestyle behaviours and different activities that we could do. Which of these do we think can help reduce the risk of developing dementia? Now there, you can select multiple answers, you can select as many as you'd like. Lots of answers flowing in here. Yes, absolutely. I think most people have come to the conclusion that absolutely it's all of these. If we want to move on, Alex, there is a slight shift towards the brain health and the staying socially active, but there are so many behaviours and lifestyle changes that can influence the risk of dementia, which is really important from a public health perspective. And we've actually got research that suggests that up to 40% of dementia can be linked to some of these factors that we can influence. And about 1 in 3 cases of dementia can be prevented by addressing these lifestyle factors. But again, only around about 1/3 of the public understand that it's possible to reduce the risk of developing dementia. And it's really important to fight the stigma that it's a normal part of ageing. And actually, it's not a normal part of ageing. And there's plenty that we can do to help combat the risk. And again, as I've listed on the screen here, several of the different lifestyle and behavioural factors that can influence dementia risk. So staying physically active, drinking less than 14 units of alcohol per week, staying mentally active, including things like doing puzzles and playing cards, staying socially active. So even having engaging conversations, as that engages the part of the brain that uses active listening skills and can recall relevant pieces of information to a conversation. Going for NHS health checks is a really important factor, as we've got conditions such as high blood pressure and diabetes that can also increase our risk of getting dementia. So as we can see, there are a lot of factors that can contribute to reducing the risk of dementia. And what I'd like to lead this on to is our work in community health profiles, as we all understand that there are going to be inequalities that exist within these factors, and they're going to be different people's access to being able to access physical activity, being able to live a healthy diet, being able to access these healthcares. And what we understand that there's going to be differences in all of our communities. And this is what we focus on in our community health profiles. So to start off, an overview of what these profiles are and how this is going to relate to dementia. But before I get into that, I'd like to know if any of you have heard of these community health profiles and if you use them in your work, either related to the dementia statistics in them or just in a more generic sense. Thank you, everyone. So interesting to see that a lot of people in this webinar have never heard of these profiles. This is a great opportunity to let you know a little bit more about this tool that we have created in public health and how it can be applied to multiple different organisations and multiple different areas of work. So just moving on to provide a quick overview of what these profiles are, is in general, they are a desktop piece of work that looks at summarising the main health and wellbeing factors across the life course. So we review everything from mental health, education, housing, diabetes prevalence, dementia prevalence, and we relate it to a specific community. We're trying with these profiles to go away from using terms like BAME and really focusing on specific communities, because we understand that categorising people in these large groups does not give us an accurate representation of their health and their outcomes, and we need to get more specific. We present all of the data in accordance to the main topic areas that have been identified in the Bolder Healthier City strategy. So you'll find topic areas such as getting the best start in life is mapped in our profiles as well as in the strategy. So it's quite closely linked to that. And our main purpose of these reports is to be used by organisations and local authorities as a core evidence base in going forward with new pieces of work, new strategies, new health improvement programmes. It could be used for a variety of work due to the breadth of information that could be found in them. And it's using lots of data either from national sources, published journals. So it's really strong evidence base to start off a lot of proposals. And we understand that they need to go further than just sitting on a shelf. So we also are using them to engage with local communities. And we've commissioned some community engagement partners to take these pieces of work and turn them into real meaningful projects. So they're focusing on disseminating this information into the communities in ways that is understandable by the community, that can empower them to take control of their own health and to advocate for resources that are more fitting to the community, and also focus on some kickstart activities that tackle some of the inequalities that we've identified in the profiles. So moving on, we currently have 14 profiles available that you can find on the Birmingham City Council website. Again, please can ask that someone from the community team pops that in the chat, and we'll have 11 more profiles coming out towards the end of this year. And as you can see, we focus on a whole range of communities and going down really specific, looking at different communities of ethnicity, communities of religious identity, LGBT plus communities, and communities with physical disability. So there's a whole range of profiles that talk about the data across the life course related to each specific community. There are some limitations to these profiles currently. A lot of the currently published profiles were released in 2021 or 2022. So a lot of our access to the newest census data was not available at the time, and they used 2011 census data. So if you're using any of that data, please be aware that some of it might be outdated. To counteract this in the short term, we are going to be creating a series of retrospective infographics from the 2021 census data to supplement these reports until they go through their full review, which happens every 5 to 8 years. Additionally, we're only informed by what the data tells us. Sometimes how the data actually represents itself in the community and how the community experience of different health topics can be very different to what the data says, which again is why we're really using the community engagement partners to support this piece of work. When we're talking about the data related to dementia, we find that dementia data is really only collected by headline ethnic group, and it doesn't provide that specific insight that we really would like to see. And there is minimal data that we can find by religious communities or LGBTQ plus identities. So there is a lot of the gaps in the data, but we've tried to piece together as much as possible that we could find. So quickly moving on to where you can find these profiles before I talk about the dementia statistics and all of the different communities' experiences of dementia. So there is a written report and accompanying PowerPoint slide that you can find on the website that has been shared in the chat. Each report is around about 100 to 150 pages, so they're quite extensive pieces of work. Therefore, there is an accompanying infographic summary existing. There are about 4 to 5 pages covering the main statistics that you can pull out. And there is key summaries of each of the topic areas. So if you are looking specifically at dementia data, you can go straight to our aging and dying well section, and there'll be a whole subsection on dementia that will clearly outline all the data. So I'm not going to talk through every single bullet point about every single community. I'd just like to kind of share some of the main overarching themes that we found across relation to dementia. So first and foremost, when we're talking about our Black African and Black Caribbean communities, similarly for a lot of other communities, dementia or Alzheimer's is the leading cause of death for Black Caribbean men, and the age standardised mortality was actually the highest that we found amongst any of the ethnic groups. Again, as you can see, a lot of the data is really only headline ethnic group, so we've only found differences in dementia prevalence for the Black ethnic group as an overall group, and showing that it's 28% higher for males and 18% higher for females. However, we have profiles on Somali community, Nigerian community, Kenyan communities, and there is minimal understanding at the minute about how the different communities experience dementia. There are some small focus groups. So for example, some Somali participants discussed mistrust with health services, making them less likely to access care. And we find this across multiple topics, that different communities have historic mistrust of services or are unaware of how to access them or get the correct support needed, which is something that we can really work on improving. If we move on to the next slide. We can see similar pictures emerging with our South Asian communities. So again, rather than just grouping it as South Asian and saying dementia prevalence is X, what we can actually see is that the dementia prevalence among Pakistani males, Indian males, and Bangladeshi males between 2017 and 2019 vary significantly, from anywhere between 66 per 100,000 deaths to 97.6 at 100,000 deaths. So we've got quite a difference in experiences of dementia within communities that have previously been grouped together as quite similar. Again, one thing that comes out across a lot of these reports is lack of dementia support and understanding, either from extended family members or lack of understanding in terms of how to access support and what to actually look out for and when to reach out for support. There's also recurring themes with a lot of communities in terms of caring for a family member with dementia at higher rates than white British counterparts. But again, the data is limited there, that it doesn't really delve into that. The why, is that because there is a preference inherently for family care, or is it because of that difficulty and some of those barriers in accessing care in the first place? Moving on, we're talking about the different people profiles with people living with a disability. So hearing loss is actually one of the main modifiable risk factors for dementia. So by eliminating the risks associated with hearing loss, we can reduce dementia cases by up to 9%. And as you can see by the infographic on the right, the differences in developing dementia with the degree of hearing loss vary significantly. So someone with mild hearing loss is roughly twice as likely to develop dementia, but someone with severe hearing loss is up to 5 times more likely to develop dementia. However, what was quite contrasting to that is, although those that experience severe hearing loss are significantly more likely to develop dementia, we actually found through studies that people who are deaf were way less likely to be diagnosed with dementia due to some of those difficulties in communicating with healthcare professionals, potentially not being provided with a BSL interpreter or the confidence to go and approach a healthcare professional with these concerns. Moving on, I'm going to go quite quickly over the next couple of slides because there is, as I said, quite little data on our religious and our LGBT+ communities. But again, some reports start to indicate that there may be higher prevalence in different religious communities, again, show more family care with dementia support, and also again show those barriers in accessing support, such as language barriers and understanding of the condition, a lack of cultural understanding in particular. With our LGBT communities, again, there was very little information on prevalence, and the studies focused more on experience of dementia. And one thing that came out from our lesbian community health profile was this feeling of a double stigma that made them feel quite excluded from the rest of the residential community, because there was the stigma associated generally with older people being quite isolated anyway, and then also with their sexuality adding on to that. So it's understanding that a lot of these communities experience different intersectionalities in their health, and someone isn't just an older adult. There may be an older adult who is lesbian, there may be an older adult who is lesbian and suffers with hearing loss, and it's understanding all of those different factors that contributes to a person's identity and how that may impact their health and their access to health. So that's just a quick overview of our community health profiles, the type of data that you can find in those profiles, and hopefully you can see that it will be quite useful for understanding dementia in a wider aspect. So that's this section done. I'm going to hand over now to Bhupinder to talk about the dementia strategy.
Thank you, Jordan. So yes, I'm Bhupinder Bhogal, and as we said, I work in the Birmingham and Solihull ICB within the long-term conditions team. And within that, we have the end of life program and also the dementia program as part of our portfolio. And just as an introduction to our team as well, we have the senior integration manager, David Fry, and also my team members, Mandeep Kaur and Katie Beddoes as well, who work within the ICB. So today I'm going to talk about the Birmingham and Solihull Dementia Strategy that has been recently launched, and we're very excited to have it launched recently in March 23, and also promoting it throughout this Dementia Action Week as well. And later on, Revinder Johal as well, who's from Birmingham City Council as well, and who has been instrumental as well with joint working across this strategy, will be speaking a bit later as well. So next slide, please. So as we said, this strategy has been a joint approach between ourselves as health and also Birmingham City Council and also Solihull Council, who have developed this strategy within engagement with a lot of stakeholders across the system within Birmingham and Solihull. So it's been developed by the leads, the previous manager, who was Catherine Drysdale from ICB, Revinder Johal, and also Anna Walker from Solihull Council. So the strategy has been developed, has been through engagement, and then has also received governance approval from all the various different boards in health and also social care. As we said, dementia, and also from the statistics that we've also seen and from the community profiles, it is a very key national and local priority for us. And by developing this strategy and also having that action plan of implementation that we have and all the priorities set out, we're hoping that we can address some of the challenges and also, develop care and improve patient experience as well. Next slide. So the background context is that we had a Birmingham and Solihull Dementia Strategy 2014 to 2017, which kind of set out those Prime Minister challenges as well. And then within that, COVID-19 hit, and we have found that dementia prevalence and dementia care quite significantly was impacted, and families were impacted tragically as well. And people lost their lives, and also the care that kind of was stood down, face-to-face appointments. And within that, we did a COVID recovery plan to set ourselves from recovering from that COVID period and understanding the impact of what COVID did as well. And then within that, we have formed the dementia strategy for Birmingham and Solihull. So we've taken that learning and growth as well through that period. Next slide, please. The dementia strategy revolves around 4 key priorities, and you'll see the running theme within the strategy, the detailed strategy, and it evolves around information, access, supporting, and improving the quality of services. Next slide, please. So I think we've already talked about kind of the national context and challenges that we do have. So as we know, there's 850,000 people who are living with dementia, and then women are also likely to be diagnosed than men. If I look at locally, our February 23 data, latest data for BSOL, Birmingham and Solihull, said that we had a rate of 59.1%. Although we know it's not just about hitting targets and rates, but that is a challenge for ourselves to improve our diagnosis rate. And we also have very much a focus of that we need to increase we need to reduce the health inequalities that are being experienced and focus on the different communities as well that have poor access to information, the appropriate services, the access to those, and also those planning and end-of-life care as well. Next slide, please. So as we said, this is why our driving force through the dementia strategy, our priorities and all the actions that we want to take is to reduce those health inequalities. And we recognise all the different cohorts that we have as well that are listed here as well. I won't read them all out, but we know that we have to recognise all the individual differences between those as well. And, using some of this community profiles data will be quite beneficial for us as well in highlighting all these differences and all the dementia impact as well on them. So as part of the identified actions, identified actions in the strategy, we're going to consider those differences and and try and get equitable care for all our communities. Next slide, please. So this strategy was developed over a significant period of time, over a year period, and we did a focused, dedicated 6-week engagement period as well last year in July. And within that, we have co-produced this strategy with taking those views of those dementia and people who have dementia and their carers and the family experiences as well. And we also had all the views from health and social care professionals as well. We did a series of number of events. We went face-to-face events like dementia cafes and Birmingham Carer Hubs, and also events that were held by Alzheimer's Society as well. And we also did surveys and also online events as well. And we tried to get the views of all the different stakeholders that have an interest in dementia. So we had Birmingham Solihull mental health colleagues, we had hospice colleagues who are more the end of life pathway. So it's been a very good mix, and also all our third sector providers as well, who do carer support as well and that post-diagnostic support. So they were very much heavily involved with this engagement. And taking that, we produced a series of a log to record all the information and the feedback from it, and we analysed all the feedback and tried to implement it as changes and feedback into the strategy with the development. So next slide, please. It's just so this slide is just recognising some of the quotes that we received, and they're quite powerful quotes from individuals. And I think once we hear from people and lived experience representatives and their families, it just puts it more into context for ourselves as people who are trying to deliver the strategy and the actions. Some of this, the one that is key highlighted is, I am a person, not my condition. I am more than my diagnosis. So I'm just recognizing that individuality of that person, that once they do get dementia, they're not lost who that person is, and trying to make sure that they can individually, independently live as well, and also that they're getting the right support and care as well. Thank you. So the dementia strategy is framed around the NHS England WELL pathway, which has the different elements that are highlighted here, which is preventing well, diagnosing well, treating well, supporting well, living well, and dying well. So the detailed strategy that we have, and I've provided the link in the slides as well, so hopefully everyone will get those when it's circulated. You'll see the running theme that we have across these, and our 4 priorities from earlier have been reflected in each of these sections. Next slide, please. So the next couple of slides just breaks down a bit of the actions and priorities of what we want to do for each of the sections of the WELL pathway. So the WELL pathway is like a route and journey across which we would say a patient and their family and their carers take throughout their dementia journey. So as we said, preventing well is to risk of people developing dementia to be minimised. And through that, we want healthy living messages, and we are relying on our public health colleagues who have been instrumental also in Dementia Action. We need to get those messages across and those resources and information as well. And we want to increase that dementia education as well. Thank you. Through diagnosis as well, we want to make sure that pre and post-diagnostic support information is easily available. They know if you have a memory concern and you want to go to your GP, and also that reducing that time between a referral to the MAS service, memory assessment service at Birmingham Solihull Mental Health, to improve those appointment times and improve the overall dementia diagnosis rate for Birmingham and Solihull. That could be in care homes, and at the moment we have a care home pilot going on, which in trying to get the diadem tool within those to diagnose people with advanced dementia. Next slide, please. So we've got treating well as well, which is quite important, and then making sure that people can have the access to available treatments that we have in Birmingham and Solihull, and that personalised care and support planning, they are supported, and also that awareness of availability of medication and non-medication treatment options as well. and also that importance of a dementia annual health check as well, and through information and resources as well that we are hoping to actually produce and release as well in June. Next slide, please. We've got Supporting Well as well, and we have the Dementia Connect service, which is run by Alzheimer's Society. We want to make sure that everyone is aware of that post-diagnostic support offer as well, and that we have all this information and resources that people can have, and they know as a central point they can go to have all those physical, psychological, financial, emotional support needs met. And also that very much importance of supporting our carers and reducing that carer breakdown as well through our carers hub services that we have in Birmingham City Council, and also Solihull, the Carers Trust Solihull as well. Thank you. So living well, just the people with dementia, we want them to be normally living in safe and accepting communities. And this is similar to our Supporting Well with all the services to make sure that they can live independent as much as possible and have that support wraparound that they need. Thank you. Also in Dying Well, as we have our end of life program as well, connecting it to all that end of life pathway, making sure that people know that dementia is also a life limiting condition, and also that personalised care support planning that they need to have in place as well, and respect forms and that process around those, preparing them for that journey of talking about the death and dying and the loss aspect as well, and also our compassionate communities agenda that is happening in Birmingham Solihull, connecting that as well. Thank you. So as part of the strategy, this is just a bit of a timeline to say that we have this as a 5-year strategy and we have a 2-year action plan. So once the 2-year action plan once we're getting closer to that, we will also be as a group developing the next 3-year action plan that we have in place and then getting that launched as well. And we have a task and finish group within our council and our Birmingham Solihull ICB as well, which will monitor the progress of this action plan and hold us to account to tell us that we are achieving them and demonstrating what impact we've had as well. Thank you. So I'm going to talk a bit more on the next slide, but this is just a slide which, again, is the actions we want to take to reduce those health inequalities and those identified challenges that we know about. So fairer access to all our communities, the digital poverty that we have, and the deprivation across different communities and patches across Birmingham and Solihull, and providing those more culturally appropriate services, and also tackling that kind of stigma, embarrassment and fear that people have as well. So if I could go to the next slide, please. So this is just some of the specific actions that we want to take and actually are doing as well. So through this launch of this strategy and also this Dementia Action Week, we're hoping to get enough engagement as well, and letting people know about our action plans, what we're doing, and getting involved as well. So that appreciation of all the different perspectives that people bring and understanding their experiences of patient and service user experience feedback, making sure that we're always connecting back to people who are living with dementia and getting them included into our dementia steering group that we have, which is a network of different stakeholders that are involved and expertise as well. So it's a very much a key that we collaborate and within our implementation of our action plan that we utilize all that expertise. So yeah, we engage with all those community and faith leaders as well last year in those 6-week engagement period that we did. Also, I think it's important that we have our equality, diversity and inclusion team involved, and we regularly review our equality impact assessment as well. And we're always having that health inequalities focus and lens in all of our implementation of our actions. I just want to talk about a little bit quickly about some of the actions we are doing and some of the things that you might want to note as well that are happening quite soon. is the Birmingham and Solihull integration pilot, the launch of an end-of-life culturally sensitive toolkit within June, which will be launching in June. And this is a development of looking at all the different major religions as well. So it's got a project that happened over the last year, and we communicated with different faith leaders and tried to get the information of what are the processes around people, what do they experience when, what they do in terms of preparing for death, and kind of the process around their dying, the kind of funeral processes or information that families might need. So it's been collated as a resource for health and social care professionals for them to take into consideration for different religions of what they would experience. And that's hopefully going to be launched in June 23 and circulated to all the different organisations to use as a resource. Something we've also done is dementia pathway mapping, which I've included a link for as well, and a gap analysis. And then that focus of doing data analysis and targeting different practices, GP practices, and also dementia information and resources, making sure that it's clear, it's of quality, it's relevant, and includes all the support services that happen in Birmingham and Solihull, so people know where they can go for support. And at the moment, we're developing the ICB web pages and also the Birmingham City Council web pages as well. And also very much importance is that education and training. And at the moment, we have a Birmingham and Solihull end-of-life framework that has been developed and development of a platform resource. So we hope that there might be some dementia resources within that as well. And at the same time, through our action plan, we also want to go to localities and make sure that we can highlight all the dementia prevalence, the gaps, and look at the service provision through all the different communities. And yep, so I think it's just next slide. So I think just to end, I just highlighted some of these key words that I really think that encompasses what we were trying to achieve through the dementia strategy, the development of the dementia strategy, and what we're going to focus on doing the action plan. I think it's really much about that ongoing learning and growth and making sure that we collaborate and get people involved, and we're having that co-production with lived experience representatives, families, and getting that engagement on a regular basis when we're implementing and delivering on those actions set, but then also coming back to that accountability and that governance as well to demonstrate what we've made as an impact and that change and innovation in what we can do for dementia care. And very much a commitment to improving our care for people in Birmingham and Solihull. So I'm going to hand over to Revinder Johal now, who's going to speak a bit about the toolkit that's been released and also the adult social care offer in Birmingham City Council. Thank you.
Thanks, Bhupinder. That's really helpful. Before I kind of go through my few slides, I just wanted to kind of pause for a moment and just sort of say that, whilst there are, a number of professionals that may be listening into the webinar, and I'm hoping that the information is useful, I'm also mindful that there may be colleagues listening in that are also supporting somebody who may recently have had a diagnosis of dementia, or they have been supporting somebody for a while. So whilst there may be a lot of information, data, and what we're doing, I'm mindful that some of this can be actually upsetting and trigger emotions. So we will put in the chat some contact numbers for our carers hub for those of you who may need some additional support, and also the Alzheimer's Society as well. So yeah, just very mindful that, like I say, it can be upsetting as well. So as Bhupinder said, before I move on, just to give you an overview of what we're doing in adult social care, I just wanted to highlight some of the new resources that NHS England have launched this week in terms of Dementia Awareness Week. And really, actually it's very timely, really, in terms of what our colleagues in public health have spoken about. So the resources, the aim of the resources then is really very much about raising awareness around the challenges that people from ethnic minority communities face when accessing dementia care. And then it's also about promoting the new resources to help narrow the health inequalities gap that we've already sort of talked about. So in the resources, there's information for from NHS England and the Royal College of Psychiatry about an e-learning module in terms of dementia awareness for those from those groups. There's also an NHS England and Alzheimer Europe guide on intercultural dementia care. And again, that's designed for health and care professionals. And there's also some culturally competent activity books to be used in care settings. And again, the aim of those is very much to make them more relevant to our diverse communities. And then finally, there's a leaflet as well designed for, like I say, for ethnic minority communities, and that's aimed at those from the voluntary and community sector and faith organisations to kind of promote awareness about dementia within those communities. So those are very much the resources. Thank you. If you want to move on. So the key message really, and we've touched on it already, is that, you know, very much that those living with dementia from the ethnic minority background is expected to double, you know, in 2026. So, and often, you know, as a result of cultural issues and issues within families, that those from those communities often face delays in getting a dementia diagnosis and barriers to services. So delivering culturally competent dementia care can improve the patient experience. So it's really helpful that NHS England have kind of recognised that. And the call to action really for health professionals is to actually look at the resources that have been produced and to use those resources. Similarly, in terms of the activity booklets as well. Next slide, please. And then again, the call to action there is for those within voluntary and community organisations, including faith organisations and leaders, to look at the resources. And there's links there again to kind of look at the resources about delivering culturally sensitive training, information, advice and guidance sort of thing. So it's very much about sort of like, you know, recognising that there are cultural differences when it comes to dementia and acknowledging that and working with communities to kind of deliver culturally competent services. Thank you. I think the key message really very much from the information is that whilst we understand cultural beliefs and norms, and, you know, it's very important in terms of understanding cultural differences in terms of dementia, what's very important though is that we take a very person-centered approach to supporting families and also those people living with dementia. So no matter what faith background you may be from, it's still important to look at the, you know, the personal needs of that individual. Okay. So just in terms of adult social care, my text has gone a little bit small here, but just to say that having worked with Bhupinder in terms of the dementia strategy, adult social care are now sort of like working in terms of implementing the actions within the joint action plan. And so there's a number of actions there that we've kind of highlighted. That's not everything, but just gives you a flavour of some of the things that we're doing. So we're looking to work with our counsellors to become dementia champions in the communities and also to increase dementia-friendly neighbourhoods across the city to try and reach our diverse communities. We recognise the importance of having dementia champions. It shouldn't necessarily just be professionals that are talking about dementia, but trying to get it out into the communities as well. So making sure that we have those dementia champions within communities who people, you know, seek and trust sort of thing and can get advice and guidance on and be able to be signposted to. We're looking to adapt our web pages in terms of the city councils to make sure that we've got accessible, easy to understand information in terms of dementia and the services that we offer. You know, we understand that, you know, if you've recently got a diagnosis of dementia, you know, the last thing you want to do is to spend hours navigating difficult pages to try and find, you know, the basic information that, you know, that you need to kind of get support. So we're trying to adapt those pages sort of like at the moment. We're also looking at piloting the review of care plans. So we're looking at doing that in a particular area at the moment, potentially Sutton Coldfield, and then we'll look at other areas across the city. And the idea really about that was very much at looking at how care plans can change very quickly. So as a carer, you may have a care plan in place sort of thing, but the needs change very quickly. So rather than waiting too long, it's about looking at, well, actually, what's the needs and reviewing those sort of like very quickly. And then also, as colleagues in public health have talked about, it is about targeting information around prevention and getting that out into the whole of the city and meeting the needs of diverse communities as well. Thank you. So in terms of adult social care, what do we offer then really? So there is a range of support for citizens and individuals who have a diagnosis of dementia, living with dementia, and also for their carers. What we have produced is a dementia guide. So colleagues in our occupational therapy team have produced this guide in co-production with citizens. And what it does is it sets out detailed information on the support that is available for those living with dementia and their carers. And it's all in this, one page, one sort of like document. So you don't have to navigate lots of pages. It's actually all there sort of like for you. What it also does is it aims to really give information and advice on what matters to you in one place, really. So it covers the journey sort of like for an individual from diagnosis, making decisions about finances and health and whether that's a power of attorney or something else. Support for carers. It's got lists of organisations that can support you. It also has the carer hub details and also, training that's available for carers, because it's a daunting prospect to suddenly be, the carer of somebody who may have cared for you when you were younger, sort of, and now you're actually caring for your, your elderly relative or, loved one. It also talks about some of the practical things, which I know at the beginning is not, necessarily what's important, but, things like sort of like looking at whether you're entitled to council tax reduction, under the severe mental impairment criteria, and also give some benefits advice as well. And also talks about our occupational therapy team and, how they can support you as somebody living with dementia to maximise your independence and whether that's through an assessment sort of thing really at the beginning. And then finally, it also talks about the role of our social workers and how social workers across the council can support the individual living with dementia as well. Thank you. Sorry, I should have said sort of like in the previous slide, and obviously you'll get all of the slides in this webinar, but there's a link there that will, that if you click on it, talks about and shows you all of the occupational therapy clinics that are available sort of like across the city. And those clinics offer appointments, drop-ins, and actually support you in going through an assessment as well. So on the previous slide, there's a link there to kind of to take you directly into that. One of the other things that we're also looking at across adult social care, and one of the key pieces of work that we're looking at, is about how technology can support individuals to live at home as independently as they can for as long as they can, sort of thing. And, we recognise within adult social care that living at home sort of independently in the community is what, most of our citizens want for as long as they possibly can. So we're working with an organisation to look at an integrated care approach around technology. And very much it's about looking at a range of technology devices that can support individuals in terms of living and maximising their independence. And the aim of the technology is very much about giving real-time data that monitors the person living with dementia and their activities. May do things like help to prompt them and remind them that it's time to have breakfast, it's time to take meds, and also sort of like reports into a monitoring centre so that they can sort of like monitor whether that person has actually done those activities. But it's also about sort of like offering some reassurance to family. So the technology is like quite wide ranging. It could be things like, Alexa to sort of like to remind things. It could also be like video connections, so you're linked in with family as well. And then it also could be links into, wider community groups and sort of like, keeping yourself active as well. And the whole aim really is not about replacing sort of like face-to-face support and care. It's actually about enhancing it. So using digital technology to kind of enhance sort of like the support for those living with dementia and providing reassurance to carers. Next slide, thanks. And then finally, for me, really, the outcomes of that technology approach is very much looking at making sure that our citizens are connected with their families and friends and the community, and that they're safe and secure. And as I said, it's really about trying to support them to remain as independent and self-sufficient at home, and to try and look at their emotional well-being and make sure that's improved. And then just having access to, or greater access to, services and information, and ensuring that citizens still receive a quality service. And from a carer's perspective, it's just trying to ensure that they are resilient and are enabled to care, and also just gives them an opportunity to, potentially, go out to the shops knowing that their loved one, can reach out to them sort of, if they need to, using technology sort of thing. So it's a piece of work that we're doing across adult social care, and hopefully, like I say, it will look to support individuals sort of like living at home with dementia, and also support carers as well. I'll put some information in the chat in terms of the actual dementia guide, so that you've got the full guide and the document with all of the information that I've spoken about. Thank you. Ed, over to yourself, yeah. Oh, sorry, just finally then, as Bhupinder mentioned, this slide then just gives you direct links really to the dementia strategy. So if you just click on the links, you've got all of the information there. And there's also information about Dementia Action Week as well, and some of the things that we're doing across the system with colleagues in Solihull, and also Birmingham and the ICB, in terms of raising awareness around dementia. Thank you.
Okay, thank you very much, Ravinda. I'm going to talk about public health work on dementia now. But first of all, we're going to start with a little bit more time on Mentimeter. So if you have your phones ready, please get them out. These are the 5 projects I will be talking about. But as I said, we're going to put Mentimeter in between the agenda and the projects. So if you could all log on to Mentimeter, and we'll give you a few more minutes, a little bit more time than normal to do the first question, because no doubt you're logging in. And then we will move through the 6, I think it's 6 questions, or maybe 7. Don't know what this means. So this is Mentimeter, which is an online platform. If you go to www.menti.com and put in the code you see here, 68081008, it will take you to a question deck online. So you'll be able to answer the questions. We will have those answers saved, so we will be able to go back to them and look at them later. And it's a really nice way of gathering data in an online forum like this. You can also scan the QR code if you have that function. So if we move to the first question, and you can see the code at the top, and you can see the www.menti.com as well. So to put that into any browser, whether it's on your phone or on your computer or laptop, and you'll be able to go straight there. So quite clearly, a lot of people on the call actually know somebody with dementia. It's a lot of lived experience here. Okay, we looks like we're stabilized at 30 responses, which is really good. Thank you. Let's move on to the next slide. Next question. So where do you go for support or advice on dementia? So I believe this is an open-ended question. So very curious as to the answer to this, where people actually go. Okay, a lot of people saying the same sort of things. A lot of people just use the internet. Alzheimer's Society is featuring a lot. I think internet's probably the most common answer. Dementia UK, Dementia Care. There's a few people that go to GPs, social workers, their peers, animal nurses have featured a few times. Okay, up to 31 people now, which is about the same as last time. Thank you very much. Okay, let's move on to the next question. You can also go back and answer these questions if you didn't quite have time or you're still learning the kind of the functionality of Mentimeter. So as you can see, we've got 3 questions here, and you can use a sliding scale to let us know how easy dementia messaging is to understand, to say if you really understand where to go to get information on dementia or you do not, and also to tell us what support is available in Birmingham specifically. Okay, 24 responses so far. I'll give it a moment more. So the messaging itself and understanding whether support is available in the city is about the same, but actually people do, probably through experience, generally know where to go for that information. As we saw previously, GPs, Alzheimer's Society, Dementia UK all feature quite highly. Okay, let's move on. So, simple question, how easy do you all think it is to get support for those with dementia? So I think it's quite telling that we have no one putting an answer in the easy, and generally people are going into the kind of it varies category. So probably maybe some work to do there. Okay, let's move to the next slide, please. What are the barriers to reaching out for dementia support? So again, this is an open-ended question. So I'd be quite interested to know, and you can put this in the chat or you can add an additional answer here. Those of you that said language, if that is actual different languages or the kind of a language used within the medical institute to discuss dementia, or if it's both. So quite a lot of different answers. Culture comes up a few times, stigma, lack of awareness, especially for people from different ethnicities. Not stigma again. The jargon, which is obviously more of medicalization language. Okay, that's great. Let's move on. You can keep putting answers in here if you think of other things. And what would be the one thing you would miss most if you were diagnosed with dementia? So relationships and independence feature quite highly here. Sense of self. Independence again. Okay, that's fantastic. Thank you very much. Should we move forwards? Okay, so I'd just like to say thank you for all of those of you who filled in some answers there. As Revinder said, it is quite a difficult subject, so we really appreciate that. So now I'm going to talk about some of the work that we're doing here in public health. Dementia Film and Panel Events is a piece of work that's coming up, probably September and October. We're planning to host essentially 2 short films on dementia. I found a couple of appropriate films online, and I reached out to the people that produced those films and asked for their permission to show them. And the idea is to have a short presentation along with a showing of a couple of short films, small break for coffee, and have a panel discussion where the panel is composed of a medical professional, somebody with lived experience, potentially somebody from Alzheimer's UK or a similar organization. And the panel field questions not just on the film, but on people's experiences with dementia or questions about dementia. So it creates an environment where people can learn what it is to live with dementia, what it is to be diagnosed with dementia, and all the different facets of that. Initially, we're thinking of hosting it at universities because they're very central, they have good parking and facilities. But ideally, to make the most out of an event like this, we'd need to host it within communities. So our first ones are probably going to be in September or October of this year. Okay, next slide. We also have opened a letter writing project. Some of you may have seen this already in the messaging we have for Dementia Action Week. The idea is, what would you say to your future self if you develop dementia? And have you really thought about dementia? This is really a preventative kind of idea here, in which what we've done is we've taken something you would usually do in a kind of cafe style environment and changed it for the online environment with the idea of reaching more people. The online forum gives people information about kind of lifestyle factors that contribute or may help prevent or delay dementia. So it gives people the information they need to understand a little bit more about dementia itself, what dementia actually is, and then asks them to write a letter to an imaginary future self who's developed dementia. In that way, it gets people to engage more with the subject and learn about it. It's open 2 days ago and it's open until towards the end of June. And what we're going to do with these letters, ideally, is host an event, probably maybe a week long, within the Library of Birmingham, because next month, hopefully, we are opening a wellbeing zone. So we'll have that space to do an event where we have letters on the wall and people are able to see these letters, read other people's thoughts up on this subject. And then we'll host other aspects related to dementia within that kind of event. Okay, next slide, please. So the Healthy Aging Survey is something that is now finished. It ran last year for about 4 months. And essentially we were asking residents within the city what it is to age in Birmingham. So specifically within the city, what is important to them and how did you adapt? The questions, the topics that were focused upon were, as you can see here, lifestyle, ageism, employment, financial planning, loneliness, dementia, caring responsibilities, and financial planning. And we've been analyzing it and looking at this data, and this is information that is influencing our future work and our understanding of aging within Birmingham. Next slide, please. We've also given so far 1 Healthy Brain webinar, and we're intending to do more throughout the year. They focus primarily on brain health, preventative information, lifestyle choices, and also information about dementia and what it is. So it's really about increasing people's knowledge and understanding of this term and the diseases that are related to it. Next slide. And we're currently doing a relationship with aging work. This isn't focused directly on dementia. This is understanding aging through different lenses. We put out a tender with multiple different groups, and we have had several people apply for them, and these are the successful groups that people bid for. Unpaid carers, including those caring for people with dementia, South Asian, people of working age with 2 or more long-term conditions, including mental health and or physical disability, and the LGBT+. This work's only just starting, so there's nothing really to report on it, and it runs for 6 months, so it'll finish at the beginning of December. The idea of this work is really to understand what it is to age in Birmingham, how people adapt their lifestyles to continue doing the things they like to do as they get older. It's using a group-based format or World Cafe format, and it's trying to kind of gather that information to sit alongside the previous survey work we were discussing. Next slide. So that's all from me. I placed a few links here so that people can access them once we have published these slides. Our work is aiming to build up an understanding for aging and dementia in Birmingham, and public health initiatives that we are currently pursuing are primarily on understanding and preventing, with other system partners really focusing on the diagnosis, the living well, and other aspects as Bhupinder was talking about. Okay, I think it's next slide, and I'm going to pass back to Jordan.
Great, thank you very much, and thank you to all our brilliant speakers today. It's been really useful, and hopefully everyone in the audience has been able to take away something useful from this webinar. And hopefully we've been able to provide you with a bit more insight into how much work is going on and the breadth of all of the information and how it kind of progresses from our community health profile work, where we're identifying that data and sometimes the lack of data where more research can be done, and what we can do with that information, to the really public health preventative approach that Edward was talking about in terms of communicating and increasing awareness throughout the bunch of different activities going on over the next couple of months, and how that also transpires into the NHS and adult social care work through the actual support for those living with dementia and the carers associated with them, and the strategy that's associated with dementia over the next couple of years, and what is planning to be done across the whole system approach. So thank you very much, everyone. We're going to take some questions now. We should have some Q&A on Mentimeter. So if there's any questions that have come through at the minute, no questions at the minute. If anyone would like to ask a question either in the chat or to pop your hand up, please do so now, and we'll have a couple of minutes for that. Also, as well, once any questions have been taken, if anyone would prefer, we can turn the recording off and take any other questions that people would prefer to not be recorded. We've got one in the chat about how you become a dementia champion, so I think I'll pass that question over to Revinder.
Hi, Paulette. Yeah, we're working through that at the moment. What we're trying to do is look at how our counsellors initially could become dementia champions, but then also extending it out to the community. So I know that during COVID, obviously there were a number of COVID champions that people used to seek advice and guidance sort of like from within the community. So having done it with the counsellors, we'll then look to roll that out to community members as well. So yeah.
Will we be getting a copy of this presentation? Yes, we will be sending out a copy of the presentation in the next couple of days, along with all of those links to the different resources. So that will be coming shortly. And I think a comment just came through on Menti quickly, and it's gone about the tech options. I'm not sure if we're able to see what that question was or where it's gone. I think what the question said was, are these tech options available now? Which again, I'll pass back to Revinder.
There are some tech options available at the moment, so it's not that there isn't sort of like technology. I think the work that's been undertaken really is to kind of look at the range of technology sort of like that we've got currently in the system, and then looking at kind of future technology. And then also looking at a whole life course. So we're looking at technology from, from when people are younger, sort of like to their middle age, older age sort of thing, and then sort of like when they become much more older, and how that can support them. So there are options currently, but the work that's been undertaken will look at kind of extending those options and looking at sort of, better, more responsive technology. If you want any more information about the technology, I'll put my details in the chat, and by all means drop me an email. It's not a problem. Okay.
I can't see any more questions coming through right now, so I will turn off the recording in case anybody